Thank you. Thank you so much, Judika, for inviting me to this Congress today, and thank you for giving me the time to speak to you today. And also, thank you to Peter for your very motivating talk on how we are incorporating consumers, not as subjects, but as partners in our innovation. And this is exactly what we do when we talk about Swift Medical as a technology that is really turning data into actionable insights that empower both clinicians and our patients. So let's dive into this. So today I'll be talking about how we are empowering patients through AI-driven wound care. Some disclosures, primarily of note that I am the co-founder of this technology, Swiss Medical. So I start off with this photo, not because it's so graphic, but because this is actually one of the first diabetic patients I saw with a chronic ulcer, okay? At this time, as a medical student, I was doing research in chronic wounds and I had imaged her wound. This was a lovely lady in her 50s who had been seen for a follow-up of this ulcer, which, as you can see, is obviously has an osteomyelitis, had polymicrobial infection. And from this wound, we extracted a Christmas ornament that had been there for about, for about at least 6 months. You know, what really shocked me at the time when I was a medical student seeing this patient wasn't just the clinical severity of this wound, but just how long people live with these wounds in their bodies. And I want to talk about wounds because, to be honest, this is an area we talk often about melanoma, skin cancers, but within our specialty, wound care and wounds is an under-discussed, underfunded, fragmented area in our specialty. 1 to 2% of the global population has a chronic wound. The lifetime risk for diabetics of developing an ulcer is 34%. And then of those patients, 17% of those patients will have an amputation. 70% of non-traumatic amputations are due to wounds like this. Yet, we're building technologies. We have technologies now that can reverse those statistics, and through accurate, reliable assessments, early intervention, patient involvement, patient education, we can change these outcomes. So we're dermatologists. Let us see the technology in action. Let us hear directly from the patients that these technologies are being used on. So what I wanted you to see from this clip was that, you know, the leveraging of visualization and AI is as important as empowering for the clinician as it is for our patients. And what you're going to see here is that you're going to be able to transform this type of care into a more collaborative, transparent process. We have already implemented our technology with over 51 Indigenous communities through 9 organizations. We've monitored over 25,000 wounds through this technology. I like this particular quote. If you'll read, "The heart of science is measurement." I think this reflects the kind of foundational role when we talk about technology, especially within our specialty of dermatology, because so much of our assessment tends to be qualitative, tends to be subjective and observations, but transforming that into quantifiable, into actionable, reproducible science is the goal. So we've been implemented in, as I said, over 5,200 facilities across North America. We've acquired to date over 33 million images, and these are scientifically calibrated wound images, which makes it the largest wound database to date. We monitored in 2024 alone over 1 million patients. Now, I feel that the success here that we're talking about lies in really merging clinical rigor. So when we talk about that, we're talking about AI-driven consistencies, validations across our 34 million images, showing that we have 95% measurement accuracy and consistency between clinicians, versus when you were using a paper ruler to measure the length and width of these wounds, at least a 40% error in measurement. This is critical when you're talking about measuring and longitudinal monitoring of how wounds are actually healing and how wounds are progressing. The other thing is that this is all designed, as you can see, with a very empathetic design, which is inclusive. You have this very simplified interface, a one-touch capture and guided workflow that accommodates, shall I say, for some of my patients, low-tech literacy. I had a patient who's 82 years old who described it as simpler than online banking. Compared to the traditional methods, we've shown in our studies that the accuracy for measuring wounds with ill-defined edges is 46% better than manual methods, more accurate by 41% in measuring wounds of surrounding necrotic tissue, more accurate at measuring irregularly shaped wounds by 40%. And this is of note, to point out that we are also using this technology to measure wounds in darker skin tones. We talked a lot about the biases that we can often see within AI, and it's important that I think the promise of AI within healthcare hinges on equitable design, and that we have a large database that is also a diverse database. And so that your algorithms and these tools, which to be honest, so far in dermatology has failed often in darker skin types due to the biased training data, which is often on Fitzpatrick 1 and 2 skin that predominates, especially in things like melanoma algorithms. But AI can solve that bias by instead of perpetuating it. So here, we have, I think you saw it in the news clip there, that there's a Swift Helix. This is an FDA registered scientific calibrant. It's basically a fiducial that calibrates for lighting, for color, for size. Now, how often during today have we talked about the difficulty of doing things with telemedicine? Because the photo is just not good enough, because patients send us photos, then you're wondering, what is that even a picture of, right? But here, you're taking that variability of patients and how good they are with their phone or their camera, and taking that away by having a calibrant, an algorithm, and a machine visioning that automatically acquires scientifically calibrated wound images. This technology was intentionally built to be made available on things like your smartphone, iOS or Android devices. This is not just an app, right? This was meant to be used as a tool at the bedside. When we talked about designing this, I wanted to be able to hold my patient's leg with one hand, examine their diabetic foot ulcer, and be able to use my other hand, not be, fumbling around with very large machinery. And all of the clinical analysis and case reviews and remote visibility happens on a centralized dashboard. Visualization is empowerment. Part of the design features involve not only the area and visual dimensions of these wounds, but also the 3D rendering of these wounds. And so here with AI-powered measurements, you can look at not just area, but you can also see depth. We can also measure tissue composition using, again, a fiducial marker that calibrates for color, lighting, and size. And this is all given back in real-time feedback. Patients are tracking their progress through intuitive graphs. I initially called it a ghosting feature, but you can see the past and present wounds in a ghosting overlay so that you can really foster a patient's motivation in watching their wounds shrink. One of the nurses that we work with reported that patients often insist on viewing their progress during each visit and after their initial engagement. And so once patients are exposed to these types of technologies, just like we talk about the fact that telemedicine, teledermatology is probably here to stay, even post-pandemic, once patients are able to see objective data, they're gonna want to continue seeing that. That is going to be the standard of care. We did a study here where we assessed patient feedback and also the utility of this type of technology. It was an observational cross-sectional study of 385 users. And the feedback on patient impact includes, and this is always a shocker to me, was the fact that some of these patients were seeing their wounds for the first time. Can you imagine that? That you've had a wound on your body for a very long time, but you've never seen it. And that's kind of makes sense when you think about it, because a lot of these patients have either poor mobility, poor flexibility. If they have diabetes, they probably have poor visual acuity. And these wounds are in hard to see places. They're on the bottom of your foot. They're on your sacrum, on your lower back. And so these aren't easy to see wounds, but to be able to actually visualize your wound and then to monitor and track how it's healing over time is very empowering. And it also leads to what the educational value of this. Once patients are able to become partners in their own care, you will see improved compliance. A lot of these, treatments that we're doing is not a pill, it's not surgery, it's not a cream I'm prescribing. This is you being compliant with your offloading devices, with your compression stockings, with your wound dressings. And so it's very important that patients, what they say is that one reported, seeing my wound for the first time changed how I cared for it. And then there's the clinician-patient partnership. Patients are reporting feeling in control of their own healing when reviewing data alongside their providers. And sometimes these can just be virtual care visits as well. We conducted a study that was funded by the Digital Technology Supercluster investment. It was a $2.5 million tele-wound care program during the COVID pandemic that supported chronic wound management through AI and collaborative care. This was really about implementing this type of technology in patients' homes and with community care nurses. 248 patients were involved. We monitored over 355 wounds, and then over 1,000 wound evaluations were completed during the year. What we saw was a 7% reduction in emerge visits, a 4-month decrease in stay within advanced wound care programs at home, and a 50% reduction in hospital readmission. Over $1,000 per patient per month was saved. This is one particular patient that was involved in the program. This was a lady who had 2 wounds on her breast. She had breast cancer, and then she had bilateral mastectomies. And as we know, when you have radiation to a site, often you have wounds that don't heal very well. The tissue is fibrosed. You have radiation dermatitis. And so she had, for 6 years, 2 gaping wounds on her chest. She was implemented within this program, the technology was used, and she was able to heal her wounds within about 6 months. It's not about the fact that this is some kind of miraculous technology that is actually healing the wounds. This is about the fact that we now have clear data, appropriate intervention, timely assessments. This was another patient. He was 57 years old, who also took part in the study. He had type 1 diabetes and peripheral arterial disease. He had prior toe amputation, recurrent osteomyelitis. What happened was during the COVID pandemic was that his infectious disease specialist wanted to see him more often. He just didn't want to come out to the hospital, of course. And so during that time, she advised him to please text me images of your wound. And so she got these, over the course of 7 months, 2 blurry images of his wounds. And so we implemented on the Patient Connect app. And during that time, from over about 6 months, he sent 39 wound images. This patient weekly imaged his wounds. And then he also had 7 virtual visits. What you can see in the chart is that as the wound is progressing, what you want to catch is that delay in healing. And that's what we were able to see early on and then implement changes at that time. So there was active debridement done by the nurse, there was a back dress that was put on, there was IV antibiotics that was started, and the patient reports things like empowerment, the security, eliminating the anxiety about sharing his images via unsecured text, reduced anxiety, secure imaging, sharing that eliminated text anxiety. And the patient says he saved at least 3 hours a trip, which for him was $50 a visit. But basically this patient, he avoided in-person visits during COVID with clinicians and gained real-time insights that his infectious disease doctor said prevented another amputation. So last thing I'll just say is that this is multispectral imaging. Now we're able to, this is like a pocket-sized device that we've developed. And I've always been kind of pushing for the idea that we should be able to look beneath the skin. And this is not, novel, but here we are using infrared, capturing hidden inflammation and bacterial fluorescence to look at pinpoint areas of infection hotspots. And here we are receiving this type of objective data and reducing the guesswork as to whether the patient's wounds are infected. This was a 66-patient study and 100% diagnosis of infection in these wounds. So I'm just going to end the talk now by saying that, this part of the success that we're talking about today, and specifically in this panel, speaks to the consumer-focused design, the simplicity, the security, the accuracy, reliability, and visibility that drives adherence and trust. I think when we talk about digital dermatology, I think it thrives when our patients become partners in the innovation, making care visible, actionable, and collaborative. We're not just healing wounds here. I think we're restoring human agency. Thank you.